I see from this NHS booklet on localised prostate cancer that they say there's a small increase in the long-term risk of getting cancer in the bladder or back passage after radiotherapy. And I'd be worried reading that. Could you comment on that?
Yes, the side effects I mentioned earlier are the common side effects that you might well expect to experience. What you're talking about is a very rare side effect of any radiotherapy treatment. So it is possible after any radiotherapy treatment that decades afterwards there may be a very slight increased risk of developing another cancer. So that's been very well shown, for example, in children who've been treated with radiotherapy. When they grow up into middle age and old age, they are at increased risk of cancer. Now, in the case of treating men with prostate cancer, men of a certain age, that's much less of an issue, because we're really talking about a risk that would happen 20, 30, 40 years after the radiotherapy. And we have looked for it in men who've had radiotherapy for prostate cancer, and we haven't yet shown any convincing increase in risk. But you're quite right, there is a theoretical possibility that you would be at higher risk of either bowel or bladder cancer after your radiotherapy.
My wife thinks that I should have radiotherapy because she's got this sneaky feeling like that it would be better for me. So if I don't join the trial, can I have the radiotherapy anyway?
Yes, absolutely. So if you decide that you don't want to go into the trial, then you will need to choose whether to have early radiotherapy or deferred radiotherapy.
Right.
Now, your doctor may be able to help you make that decision, but the truth is that no one knows which is better. So some doctors favour early radiotherapy and other doctors favour deferred radiotherapy. At the moment, the jury's out. There isn't any proof one way or the other. So we're not doing the trial because we've got some sneaky inside knowledge that you need to have radiotherapy. We're doing the trial because there's genuine uncertainty amongst the experts as to which is the better approach. Early radiotherapy for everybody, or deferred radiotherapy for those if and when their cancer comes back. You're facing the same problem really, whether you go into the trial or not. If you don't go into the trial, then you need to choose whether to have early or deferred radiotherapy, and it may turn out, in years to come, that you chose the less effective treatment. If you do go into the trial, then you'll be allocated either to early or deferred radiotherapy, and once again it may turn out in the fullness of time that you were allocated to the less effective treatment. Perhaps it's worth saying that what we will gain, what the next generation of patients will gain, is that they won't be faced with this difficult choice. So when the results of the Radicals trial are in, then men who are in your situation in the future will then have some hard evidence, some hard facts to guide their choice. They'll know how early radiotherapy compares with deferred radiotherapy, both in terms of its effectiveness and in terms of its side effects.
So is it the benefit mainly of people to come rather than us?
That's right. We can't guarantee that you personally will benefit from taking part in the Radicals trial. What we can say is that men in the future will be able to make an informed choice between early and deferred radiotherapy, armed with the results from this trial.
Okay, thank you.
I was pleased to have my surgery at a very famous centre. So why do you need to do the trials now? And over the years you must have had many patients, and surely you know the best route to go down anyway.
You might well think that, and certainly there have been tens of thousands of men who have been in your situation in the past, and some of them have chosen to have early radiotherapy, and some of them have chosen to have deferred radiotherapy. But the problem is, we've never done the trials comparing those two approaches. And so, while we could compare the outcomes of men who've chosen early treatment and men who've chosen deferred treatment, there's absolutely no guarantee that that's a fair comparison. For example, the men who've chosen early treatment might in fact be fitter and healthier than those who've chosen deferred treatment, which would violate any comparison. let me draw a comparison, if I may, with breast cancer. So in breast cancer, there have been dozens of trials comparing early radiotherapy with observation. And those trials have been conducted over the last 30 or 40 years. They've involved more than 30,000 women who've been randomly allocated either to radiotherapy or not. And as a result of those trials, we know precisely what the benefits of radiotherapy are after surgery for breast cancer. And that's why women with breast cancer are routinely treated by surgery followed by radiotherapy. In the case of prostate cancer, those trials just haven't been done. And so it's a matter of speculation as to whether men should get early radiotherapy or not. And so that's why we want to do the Radicals trial, to actually get some good quality evidence so that we'll know whether or not men like you should have early radiotherapy or not.
It surprises me that these trials weren't started 30 years ago.
It surprises me too. It's shocking, really, that there's such a disparity. But at least in decades gone by, prostate cancer was rather neglected compared with the other common cancers. And it's only now it's starting to get the attention it deserves. And it's the same with clinical trials. So the clinical trials in all the other common cancers have been done. So, for example, in lung cancer, that's another example where they've done trials comparing surgery with or without early radiotherapy. And lung cancer is interesting because early radiotherapy doesn't work. So in lung cancer, the standard is to treat with surgery alone and not to use radiotherapy, which really goes to show why we need to do the trials in prostate cancer. We can't just assume it'll be the same as breast cancer or the same as lung cancer.
Is there a large percentage of men that need radiotherapy following a prostatectomy? I mean, are there very many failed prostatectomies that need this salvage treatment?
Yes. Across the board, of all men having radical prostatectomy for prostate cancer, we expect around about 40% of them the cancer will come back. And especially if you look at men who have risk factors for cancer recurrence at the time of the surgery, then we expect around 20% of them to die from prostate cancer after the operation. Typically, they tend to die 10 or 15 years after the operation, so it's a very late event. But the reason for doing the trial is to try and reduce the risk of dying from prostate cancer in the long term after the operation.
Is that proved? It's 15 years after?
Yes, so we've got data on tens of thousands of men who've had surgery for prostate cancer and who have been followed up over the years. And if you look at men with risk factors for recurrence, so either a high PSA level or a Gleason score of 7 or above, or positive surgical margins, or extension of the cancer beyond the capsule of the prostate, then we expect around about 20% of those men to die from their cancer in the long run after the operation. Now, we do know that using radiotherapy will reduce that risk of dying from prostate cancer, but what we don't yet know is when that radiotherapy should be given. So we don't yet know whether all men who are at risk should be given early radiotherapy shortly after the operation, or just those men whose cancer does come back should get deferred radiotherapy later on.
What would be the causal factor for a recurrence? Lifestyle, diet, or just because some of the cancer cells were left?
So the factors that we know of that make men more likely to recur after the operation are the four that I've mentioned: the PSA level before the operation, the Gleason score, that is how aggressive the cancer looks under the microscope, the margin status, whether or not the cancer extended up to the edge of the surgical specimen, and the stage, whether or not the cancer involved outside the prostate, sometimes into the seminal vesicles. So those are the four risk factors that we know of, and men who have none of those risk factors are very unlikely to have recurrence after the operation. But if you have any of those risk factors, or any combination of those risk factors, then you're at much higher risk of cancer recurrence. You mentioned diet and lifestyle. Diet and lifestyle might have an impact on the rate of cancer recurrence, but so far that's a matter of speculation.